What's up, guys? It's Dr. Tim Jackson with another episode of the Boss Body Podcast. So, peptides, neuroimmune syndromes. We've talked about peptides before, but now we have the godfather of peptides,
Yeah.
Dr. Kent Holtorf, the busiest man on the planet, by the way. Welcome
Yeah.
to the show.
Oh, thanks. Yeah. How long did it take us to get
Yeah,
into?
it took me about a year and a half to get Dr. Holtorf on the show.
And I was trying like every every day to do it.
Yeah,
So I
he's
apologize. We have a
that
lot of
good. He's in
patients.
demand. It's a good problem to have. But I came across your work many years ago. I had downloaded a presentation from a conference or something, and you were talking about cellular hypothyroidism, Th1, Th2. And I'm like, this guy, he knows what he's talking about because I always looked at things through the lens of immune dysfunction, which ultimately leads to inflammation. And a lot of people will say, oh, well, no, it's just a testosterone deficiency. I'm like, okay, but why? So, talk to us about immune system imbalances and how you sort of came across them and then got interested in pursuing that route.
Yeah. And just a side note, it's funny, you go to immunologists, they don't even check your immune system, you
Yeah.
know. Um, but it came out of basically me being sick, which you'll see a lot of people in this. I don't even know what to call it. Integrative. I don't like alternative, functional, whatever the heck we are, quacks, whatever you want to call it. But I basically was always very evidence-based. And in medical school, it's ingrained anything alternative means no evidence, right?
Right.
And so all growing up, I had like one pupil bigger than the other, like significantly. My arm would stop working, like half my body would be freezing and dilated, the other half or constricted, the other half, weird symptoms, but I was functional. Then as I got into college, it started like, hey, oh my God, I'm getting like this fatigued. And then through residency, I got to the point where I was like, it was so mentally overwhelming and physically to talk to a patient. I'm like, I don't think I can continue. Went to all the university doctors and they're like, oh, you're stressed, you're depressed. I'm like, I'm not. I can't concentrate, I can't function. I'm just achy all over, fevers. And they're like, oh, it's just stress, like put me on antidepressants. I'm like, of course it didn't work. And it got worse and worse. I'm like, what am I going to do? And so I went into anesthesia, figuring, hey, you don't have to talk to them; they're asleep, and just,
Right.
um, but I forgot about that. You got to be there really early in the morning.
Yeah.
And then, again, it's ingrained that, anything integrative alternative means no evidence. And I go, I got to do something. And I kind of snuck off, didn't tell anyone to a bunch of integrative conferences. And I'm like, wait a minute, these are more evidence based than what they've been teaching me. And I ended up doing, hormone optimization, thyroid. That's when thyroid became my passion. That helped so much, basically straight T3, but basically kind of did a lot of different things and was going, oh my God, I'm a new person, And so I go, I got to get out of this anesthesia. No offense to anesthesiologists, it's like mindless. Like, okay, put them to sleep. Okay, put them to
Right.
sleep. And then went into family practice. I took over an insurance-based family practice, and within just barely over a year, converted all the cash, and we called it the Thyroid Optimization Clinic. And just doing straight T3, because so many people need it, you can fix so many things. And and then so went along, and then went through a nasty divorce. Stress is a killer. Emotional stress is a killer. All of a sudden, it resulted in, I consider myself chronic fatigue syndrome at the time. Was doing pretty well, and all of a sudden, bed bound, sweating, anxious. You're on jump out of my skin. I had allodynia, where you can't even touch your skin. Um, and blood pressure up and down, and and POTS. And then I went into it was a little later. So then I was diagnosed with Lyme, Babesia, Bartonella, multiple reactivating infections, just everything becomes a vicious cycle. And I was on 6 or 7, I kind of did the Horowitz protocol type thing. 6 or 7 IV antibiotics at a time, rotating at 3 times the dose, didn't do anything. And many days I was bedbound. Then I went into heart failure, and I go to cardiologist, and he says, "Wow, your heart's fibrosed. It won't fill. It's permanent." And I couldn't stand up. I couldn't walk upstairs. And he said, "Maybe in 10 years you can get 10% better with rigorous, cardiac rehab." I'm like, I am not living like that. I mean, it sucks. Oxygen is good and not getting it. And so I basically said, okay, said I'm gonna end it on the next Halloween, right? I don't know, for whatever reason. And kind of went around the country, around the world. A lot of things helped. Ozone, it tended to be the immune modulators. Went to Omar Morales's place, Lyme, Mexico, and did he was doing dendritic cell therapy, so I called him up and said, what if I bring Lyme antigens and stimulate dendritic cells, the antigens, and give them? I felt really good. And then we tried to freeze it so I could take it home. We messed that up. But then went to Europe and was trying things, some crazy, a lot of things worked, but nothing was like, And then I did in Belgium a bunch of peptides, and I didn't even think they would do anything. And about 4 or 5 days later, I realized I was bent over the whole time trying to catch my plane at 1 mile an hour, just sweating. And you get in the seat, and the flight attendants are like, "Are you okay?" And I remember just because like panic, every minute was like days, and the doors closing. I'm like, I gotta get out, I gotta get out of here. And I just didn't have the energy. I go, okay, I'm gonna die. But and then all of a sudden I just walked up the damn stairs. I'm like, wait, what did I do? And so I backtracked and found it was peptides. Okay, give me more of that. Oh, I'm feeling better. And they weren't allowed to be in the US at the point, but then actually Taylor May was able to bring them in. So I spoke for them, and that kind of just changed everything. I mean, it was really big in straight T3, which I think is amazing, because really just about everyone's low thyroid because of the hypothalamic, the pineal hypothalamic pituitary thyroid axis. And then the thing is, when you get a chronic infection or stress or even aging, you get this. So think of Th1 get stuff inside the cell. Everything's an oversimplification, but this is a good way to look at it. You can put Tregs over here, and then Th2 gets stuff outside the cell, and then add Th17 to that, which is like the autoimmune basically pathway. And everyone's like this. And then I was doing, again, massive doses of IV antibiotics. They weren't working. Why? Because my natural killer cell function was 0. And I remember I had sepsis in a local hospital. I remember the nurses doing the shift change, and they're like, "This is that damn AIDS patient who keeps turning up negative for HIV." And then so after I was able to modulate that, learning about with peptides, there's a number of things that you can do. And you look at things that work tend to be immune modulators. Ozone, even vitamin D, basically, let's see, like, what else? Oh, even like laser, and a lot of the supplements, but they're not quite as powerful. And so you look at the immune modulators, peptides are very strong at raising that Th1 and lowering that Th2. And also what happens if you even just look at aging, and this is how we found, no matter what the condition, it's the same pattern. If you look at chronic infections, neurodegenerative disease, Alzheimer's, Parkinson's, MS, fibromyalgia, chronic fatigue syndrome. I mean, it's basically every depression. You're like this. So once you kind of snap that back, and we'll look at like natural killer cell function as a downstream marker for Th1. but you have to get it through National Jewish. The problem is like there's LabCorp and Quest, and the key studies that we use with LabCorp are almost always normal. And so you got to use Quest. I hate Quest. They are terrible. They miss half the tests, but LabCorp's tests are they're all just typically normal. And then for the second part, for the Th2, probably the key is human transforming growth factor beta. And it stimulates mast cells. You get mast cell activation syndrome, causes fibrosis. And that's what happened to my heart. It just fibrosed. And by lowering that, I was able to basically unfibrose the heart. And after about a year, I walked into the cardiologist's office and he's like, wow, wait, what's going on? And he does the echo and he goes, pretty much normal. Did he ask me what I did? No, he goes, okay, I'll see you in a year. He doesn't ask anything,
Did your cardiac output improve?
Oh, totally. Yeah,
Gotcha.
because it was just so fibrous, it couldn't fill to eject.
Right.
And he didn't even ask a thing, which was funny. But you'll find also with high human transforming growth factor beta correlates with symptoms the most, and it causes this whole vicious cycle. It also causes, NASH, heart failure, kidney dysfunction. I still have some low level chronic kidney disease just from leftover from these infections. But if I take the kidney bioregulator, like this little TMI, but I'll dump protein in my urine, so urine's foamy, blah blah blah. And but if I take even just a single bioregulator of the kidney, about 2 hours later, no foam and lasts for about 2 weeks. So the bioregulators are huge. But now even just let's look at aging. So at about age 9, your thymus, which is here in your breastbone, starts involuting. And it also depends on stress, obesity, a lot of different toxins. And it starts going down, which directly affects this, lowers Th1, increases Th2. So not only it's a sick phenotype, a age phenotype, and also with low Th1, you can't do a couple of things. Autophagy doesn't work. So you can't clear all those, senescent cells. And I don't want to get too complicated here, but the senescent cells, if there's a lot of oxidative stress, DNA damage, aging, normally the body will clear those. But what happens, they become resistant to that. And instead of doing what they're supposed to do, they start making reactive oxygen species. So cause all this inflammation. If you look at heart failure patients, up to half their heart is senescent. Kidney failure, NASH, diabetes, they're huge. So there's a number of ways to basically get rid of those cells. But what you need is the high Th1, the natural killer cell, and the other Th1 to be able to go in and recycle those cells. So if you don't have that robust Th1, you can't do that. And you also needed for high Th1s actually required to convert IgM antibody to IgG. And so when you look at, like, let's say chronic Lyme patients, like I started out with a 41 kilodalton IgM, right? So usually you get IgM first and then IgG later, and IgM just kind of like holds on to the organism. IgG uses complement and explodes it. So, false positive because you had the symptoms for a long time and it's an acute antibody, false positive. As soon as I fixed my immune system, I had 7 IgG bands, So, and then what happens, and I'll try not on this whole diatribe, but you get not only pineal, hypothalamic, pituitary hormone dysfunction. So you have low TSH and actually high T4 because of mitochondrial dysfunction. So the endocrinologist, you're kind of high thyroid, but they have low free T3 and high reverse T3. You get, again, mitochondrial dysfunction. You get immune activation of coagulation. You can't detoxify because you need energy to detoxify. You get gut brain and brain gut access. You get leaky gut. You get leaky brain. You just, everything is a vicious cycle. So, what we do, we fix the immune system. So many things get better. And then you can say, okay, well, now we need to concentrate on that, concentrate on that. So it's like, for instance, like POTS. Everyone go, oh, I can't treat this. Like, okay, just we're not even going to pay attention to it. You fix the immune system and hey, my POTS got better, or autoimmunity. It's just, MS. Okay, 2 weeks, it'll be fine. And I've not seen an MS patient that doesn't have chronic infection either. And we're all just overloaded with this, and stress. We think stress lowers immunity, but it actually does this. So
It flips the
yeah,
seesaw.
yeah. And so all these conditions are essentially the same underlying issues. And so which makes it so much easier to go from point A to point B, you know, instead of trying to fix all these different things. And we like to put people in boxes. And so, oh, you have this diagnosis, so you get this drug. No, fix the underlying issue, and almost everything gets better.
Yeah, to your point about going to the conferences and saying that, oh, this is more evidence based. I noticed the same thing because, I mean, even in my textbooks in school, you open the front cover, sponsored by Pfizer, sponsored by Merck. Like, why would they sponsor? My buddy, my best friend from undergrad, was interviewing where I got my doctorate for his psych residency. And the guy gave him like a t shirt, some pens, some other, handouts. And he's like, what is this? And he goes, oh, Pfizer sponsors my band. And so, it's funny when people say it's not evidence based because we've actually incentivized intellectual laziness where you can be a traditional cardiologist or traditional anything. And, you have a 5 to 10 minute office visit. Okay, here's a statin, here's Crestor, Lipitor, yada, yada. Let's put in a stent.
Which are
And
both malpractice, basically 90% of the time.
Right. And the standard of care is based on what the other idiots in your area are doing. So, I mean, none of it is really based in science. Would you agree?
Oh, totally. And you look at the journals, there's no cover of the journal anymore. It's wrapped in an advertisement, and the drug companies have 15-page ads. So now, do you think they're going to publish a study that goes against their advertisers? And so a number of studies, Annals of Internal Medicine, JAMA, which is actually the most biased thing ever, throw that thing away, but showed that most doctors are practicing 10 to 20 years behind what's available in the medical literature. And it takes on average a proven new therapy to get accepted into mainstream medicine takes on average 17 years, unless it's a new drug with a sales force. Okay, why is that? One, doctors don't read medical journals. They don't, but that's not even the biggest reason. Most doctors stop reading or doing anything after residency and just keep doing what they've been doing. So if you give a doctor 10 studies, 50 studies, 100 studies and go, oh, here, what you're doing isn't optimal. No, my patients are better. And this even got to like, the Los Angeles Times and all the newspapers, like, what's going on. And so these doctors are practicing so far behind, but who do they come after? The integrative doctors, because they're so far ahead. Like, hey, that's that. You're not supposed to be doing that.
Right.
It's crazy. And I don't know. You probably noticed that we see patients from other doctors, like Kaiser, whatever. It's like this is barbaric. And
Yeah.
they have multi-system illness, and they'll check a CBC, a chem panel, and a cholesterol, and then go, "Oh, you need a statin." Like, oh God, it wipes out their mitochondria, and all the studies showing that actually the higher your cholesterol, the less likely you have heart disease, and they
Yeah.
won't give up on this cholesterol theory of heart disease.
They
It's
won't even, I mean, even lipoprotein A, apolipoprotein B, tons of studies to support that. But they're hyper focused on total cholesterol, which Dr. Daniel Amen, he said when he was working in the prison system, the prisoners with the lowest total cholesterol were the most likely to have violent outbursts. And so, plus
yeah,
your cell membranes, 30% of your cell membranes is made of cholesterol.
Yep.
and it's the
Yep.
precursor to pregnenolone, which makes all of our steroid hormones. Why would you want to lower that? It's the oxidation of the cholesterol and the inflammation that hardens it, and then LDL can't pick it up, or HDL can't pick it up and take it back to the liver, correct?
Yeah, and really the whole cholesterol theory is dead. And you look at the meta-analysis show that there's no correlation between cholesterol levels. And these are standard. There are some subsets that do correlate. And in fact, those with the highest level of cholesterol had the highest quartile. And these are meta-analysis, and over and over and over have the least likelihood of having heart disease. But doctors, or I can't stand it, they'll give like a 35-year-old guy with high cholesterol a statin. And they've got muscle aches, got mitochondrial dysfunction, and it's shown to actually accelerate heart disease, depression, joint pain. They're killing off your mitochondria.
And
And
Alzheimer's, right? Don't they
Alzheimer's,
especially Alzheimer's?
absolutely. And because like Alzheimer's is a mitochondrial deficient condition, like so many other things.
Right. And let's go back to the point about the immune cell subsets. Do you have a lab? I think Cyrex Labs does it, where you can look at the immune cell, the subsets. I know LabCorp and Quest, you can do like CD56, CD57, but do you have a particular lab that you like to use for immunophenotyping?
Yes and no. Some of the ones that look at cytokines can really lead you astray because oftentimes, let's say the body is low TH1, but it will start like trying to raise that and secrete all these cytokines that are considered a TH1, and oh, you're TH1 dominant, so it can really lead you astray. And it's interesting, like, they say, certain conditions are TH1 dominant, and like, Graves versus Hashimoto's and rheumatoid arthritis. And I was like, doesn't make sense because they all respond to the same therapy. And what it was that the TH1, they could not differentiate early on between TH1 and TH17. And so they're really TH17 driven. And so people like do this whole thing and try to, oh, we got to do the, but oh, I have not seen a TH1 driven illness. I mean, they're out there, but they all, basically respond to this, because it's really an age sickness phenotype, and it is consistent across thing. Like, with the veterans, it is like, oh my God, they were like a sick person, but exponentially worse. Yeah.
Yeah, absolutely. And to go back to your point about thymic involution, I know that melatonin can help reverse it, but also growth hormone and the growth hormone releasing peptides. I've seen scans, I think it was from an A4M conference, where they showed someone's thymus before growth hormone administration and then 10 to 12 months later, and it doubled in size. Talk to
Yeah.
us about things that can reverse thymic involution.
Yeah, so it was the HIT trial. This kind of that they basically gave growth hormone to reverse thymic involution, but then they said, oh, it's going to cause insulin resistance, which it really doesn't. Like growth hormone will worsen slightly, but clinically not relevant insulin resistance. But IGF-1, which then it makes, actually improves insulin resistance. Then they gave DHEA. So that combination, it was a small study. They saw a little bit of difference, but this my thought, like, okay, why are you going through all that when you're basically low in thymic peptides? Just give thymic peptides. We have multiple to choose from. We have ones that are orally bioavailable as supplements. We have injectable, and why not just do that? And then you can give things like pineal peptides, and you look at the power of, if you're going to do any like two things, a pineal peptide and a thymic peptide. And for instance, they did a human study patients over 65 with significant heart disease and followed them for 15 years. They gave them 6 doses. And the ones that got that combination, dramatically less cardiovascular mortality, morbidity, less cancer. They had like a 2.5-fold reduction in mortality. Their cardiovascular system got better. They didn't have frailty. Then they had a subgroup that they treated more intensively, and it was like a 4-fold decrease in mortality, and it increased quality of life. And like, why aren't we using this on everyone? And they can't find a side effect. They can't find, and so, so peptides have like there's so much data on them. We have so many different ones, and you had bioregulators in there. And of course, the FDA in its wisdom, anything that's safe and effective, they're going to ban, and they're basically the enforcement arm of big pharma. So
They're protecting the public, though. I thought
that what?
they're
Oh,
protecting the
exactly. Oh,
public.
God. Well, it's like thymosin alpha 1 was proved an orphan drug. They made the mistake of coming out and showing with early COVID that it was safe and effective for COVID. And they can't have that because now they can't put out the emergency, thing, I'll call it. So and they banned it. And so it's crazy. It's frustrating. And all these things with COVID, nobody really, or a tiny, tiny fraction should have died from COVID. And there was a province in India that were doing early testing. And so they tested positive. They would give them ivermectin, hydroxychloroquine, a flavonoid, zinc, vitamin D. And over the months, they were declared COVID free in this province. That was about 2/3 the population size of the US. Great. And then all of a sudden, the US put pressure on India. Hey, what's this rogue province out there? They got to start vaccinating, and their COVID just went up. They started doing the thing. I mean,
That's crazy. So we know you focus a lot on chronic inflammatory response syndrome. Let's talk about mold mycotoxins. I know different ones like gliotoxin affects the central nervous system and brain. But the one thing they all have in common is they're immunosuppressive, correct?
yeah, and really, they look, and when I was supposed to write a chapter on SEERS or SARS, people call it different, but essentially mold, but it can be also other things as well. But it's exactly the same as chronic fatigue syndrome, fibromyalgia, neurodegenerative diseases. But so it's supposed to be 8 pages, and I kept going, and then it was 88 pages, and so we have it out as an ebook and a book. And the problem is I never finish anything, and I got to add the bioregulators into that. But what happened was we had all these, SEERS patients coming in, and I'm like, they're on these binders, right? And I'm like, how long have you been on it? 8 years, but I know I'm going to get better. Shoemaker says I'm going to get better. I'm like, hey, I'm ADD. I can't wait 8 years for you to get better. And the difference is the whole basically protocol tries to get rid of the toxins to fix the immune system, right? And if you have a low Th1 and poor immune system, you can't even detoxify very well. So I'm kind of like, let's fix the immune system first. And now you don't, you can just get from point A to B in months, sometimes weeks, and instead of just trying to slowly get these toxins out. And things like BPC 157, TB4 frag will actually protect the body against the toxins. So even if they're there, and so once you fix this immune system, so you'll have high human transfer factor beta and high C4A, low natural killer cell function. They're often hypercoagulable, so you want to check D dimer. prothrombin fragment 1 and 2, thrombin and a thrombin, protein C, protein S, soluble fibrin monomer. And then now with the thing, look at troponin and some other cardiac markers, which is very, very prevalent. But and also a lot of it is vascular inflammation. So there's a vessel bioregulator that is wonderful for that. And so we do a live cell. We put people's blood up on the screen, can't use for diagnosis. But their red cells are just all clumped. I remember when I had kind of Lyme and Babesia and stuff, and I go, God, I had all these root canal. I go, I'm in my jaw's infected. I can feel it, swollen glands. I go to standard doctors, oral surgeons, integrative doctor, biologic doctor. No, it looks fine. And then finally, I did a CT of the jaw. It was just loaded with infection. And I ended up going to Switzerland and 9 hours under surgery digging out butter. And then I went up to, which I think I went up to the top of the Matterhorn, it seemed like, and did this inesphoresis, which is like plasmapheresis, but with plasmapheresis, they basically take your blood, and they split your plasma in your blood, and they just throw away your plasma and give you albumin, which is a human product. It's probably low risk for infection, but spike protein could be in there. So, but this is the only thing that can filter your blood. You can choose different filters that will filter spike protein, heavy metals, tons of environmental toxins, mycotoxins, endotoxins, inflammatory cytokines, autoimmune. And then so I did it, and first, so they do the live cell, and the guy jumps up, his clipboard and pen go flying, goes, "This is the worst blood I've ever seen in 35 years." It looked like chili. And he's like, "I can't believe you're alive. And then after two treatments, we did it again, and totally free flowing. And so it's not available in the US, but we took me like 2 years begging the company and that we're going to do FDA trials, but because it's class 3, we can start treating even before clinical trials. So because there's a predicate thing similar to it, and it's very safe, very safe. But love that. It's like the best treatment for essentially everything. And you look at all these, we're just bombarded with toxins, right? What do you do? Or like Camp Lejeune, or I know Hawaii, they had the jet fuel to contaminate all the water. And these people are just, okay, just wait till you get sick. This will actually filter it all out. So we'll have that, and combine that with the red light bed. And I mean, there's so many different entities. Ozone's great. And so peptides are awesome, but everything works better in a synergistic effect with other things.
Yeah. And the inesphoresis, how much is that for treatment?
It's probably about a couple grand, but it can take over so many. It's not like you have to do it every day. We say, basically 2 treatments, and we haven't got it yet to really analyze all the costs yet, but and I think that's what I paid in Bavaria. But we'll see. We don't like to jack things way up. We do have to hire I don't have time to do it myself, but a plasmapheresis doctor, usually an ICU or NCL. So that costs money, plasmapheresis tech and all that stuff. But it's kind of like R2D2. It's all self-contained and knows what it's doing. But it's incredible. People are flying out there just to get it. But hopefully we'll have it here in the next couple months.
I know Dr. Dietrich Klinghardt talks about apheresis. They do it in Switzerland and other parts of Europe. Is that similar? I know they filter stuff, but I didn't know how much overlap there would be.
Yeah, and he may be talking about the inespheresis because maybe people don't know the inespheresis because Klinger was actually part of the group that has it.
Okay.
So, but in general, we say apheresis, it's generally the splitting of the blood, then they just throw your plasma away. So it's kind of just dilution. You're getting rid of, like half all the toxins. So, but it's not being filtered. Well, this will filter the entire blood. And it's interesting, the second time you do it, you dump about twice as much. It kind of
Wow.
gets everything going. Yeah.
I back in April and early May, I flew to a colleague's clinic in Idaho. Well, I hadn't seen them in several years, husband and wife team, but they have an EBOO, the extracorporeal blood ozonation oxygenation. And some people claim that it filters. I've had 10 pass ozone and the EBOO. The 10 pass is more like whacking you over the head. The EBOO was more like a steady state, lasted for quite a long time. And I think it was like 800 and something for treatment, roughly. Do you still do ozone? Do you find that
Oh, we
to be
we we
helpful?
love ozone, and we'll do the 10 pass. We don't do the hyperbaric because it's not hyperbaric when it gets in your blood. And then you really need a doctor, basically putting it through. And so doctor has to stand there, makes it much more expensive. Most people clot, and so we just put a 1,000 liter bag, put that in, add all the ozone and put it up. And I bought an EBOO machine and I hear it's filtering. I'm like, it doesn't filter. Well, it has a filter, but it's just ozone, runs through the middle and the blood around the side. So it's what's filtering ozone and it's diffusing in. And then so I bought it from a friend from like 20 years ago, but then he wouldn't return my calls and then he died. I don't know,
Oh,
but
wow.
so I'm not getting my money back. So yeah. Um, yeah, I think it has its place. And then we've also used other machines and it kind of complicates things but I'm not saying they don't work by any means. But we find and then with like even eBoo, you're always messing around with it where we can do multiple at a time. That way we can keep the costs down. And I think the results are as good, if not better, because rarely do we clot. The other ones, it's always like oh, sorry, we only got three in because
I took, before my EBO treatments, I took serapeptase, like 3 tablets on an empty stomach, and that probably enhanced it. It might be TMI, but I peed out strands of candida, long, stringy white stuff. But the coagulopathies and the thickness of the blood, I think I remember seeing in one of your presentations that that plays a role in cellular hyperthyroidism, correct?
yeah. The study, old study by Lowe, but it's very interesting. We'll find is that almost everyone who's sick or has a immune dysfunction and inflammation, they get immune activation of coagulation. And so the body, what it does, it tries to wall off the infection on the vessels. Now it doesn't make a clot, but it lays down fibrin. And so as you lay down the fibrin, so nutrients have a hard time getting in, waste products have a hard time getting out. Then as you get more, now oxygen has it usually takes seconds to get in, can take up to 2 minutes. So we find people with like the air hunger, you give them heparin and it goes away. You can do a little parlor trick. It's not totally perfect because it has to do with also how the patients, how much they're trying. But it's kind of neat because you do it the first visit and you put a pulse ox on, right? And so usually, and these people are, 99% like, well, wait a minute, I thought they're hypoxia. No, no, no. Problem is not getting into the cell. So you basically tell them to blow out all their air and hold their breath. So now, okay, so the oxygen comes in the lung, it goes to the heart, into the body, then it should go into the cells.
Mm.
So if you cut off without all your air and cut off that oxygen, it should go down to 70 and some people even lower. But people with this hypercoagulability and have this fibrin laid down, it just stays like it may drop from 98 to 96 or 95, but it doesn't go anywhere. And like you go to the hospital, oh, great, you have all this oxygen. Well, no, it's not getting into the tissues.
Right.
And so it's kind of a neat little parlor trick. And the problem is when you check all these coagulation markers, some of them are the body laying down the fibrin and some are cleaning it up. And it kind of tends to come and go. So sometimes, oh, it's negative, and then all of a sudden it's positive, but they have all the symptoms. And we've had a lot of people there. Well, we'll give them heparin. I like doing that. You can also do, the lumbrokinase, nattokinase, or peptidase. But I find if they have it, it just takes too long to do it, where those are good for maintenance and prevention. But I remember a couple cases where we're beaten on this, Lyme patient and nothing was working. And we talked about heparin and stuff. Oh, I don't want to do it. And IVs, nothing. And all of a sudden we gave him the heparin for, I think, 4 or 6 weeks. Then the same things we did, he's like, oh my God, I feel so much better because now it was getting into the cells. So when
Okay.
I see people and they're hypercoagulable, I have good news, I got bad news. Bad news is you're hypercoagulable. The good news is you're hypercoagulable. And because we can treat it and it can make a profound difference.
Absolutely. And do people, once you treat the pathogens and regenerate the thymus, do those coagulopathies, so to speak, tend to go away?
Yeah, yeah. And we'll treat usually for like 3 months. We'll recheck it. And what happens too sometimes though is so what the body does, it walls off the infection and starts secreting like antimicrobial peptide in there. But like Lyme and other organisms have learned, like they'll wrap themselves in fibrin and so that it doesn't touch it. But then if you once you release this, you may release some pathogens. So they go, oh, I feel terrible. Okay, good. And interesting thing too is, okay, tiny, tiny shot, right? And we're not anticoagulating them, so it's exceedingly safe. Although patients are like, oh my gosh, I want heparin, but we're not even generally changing the PTT or anything. Just pushing that balance. And so like they'll bruise initially because they're clotting everywhere, right? And so they tend to bruise because there's no coagulation factors where they're either injecting or they hit themselves. Then over time, as you cut off that where it starts to stop coagulating area, it's kind of like a mini DIC, like when in an ICU, that they stop bruising. So it kind of gives you a marker too.
Absolutely. And low dose naltrexone, we talked about that TH1, TH2/TH17 seesaw. My mentor talks about most people, like you said, are stuck in TH2. That's where you get the three A's, the allergies, the asthma, and the autoimmunity. And so the LDN will help you go back more towards a TH1. And what people think is a reaction to the LDN is actually the immune landscape changing, correct?
Yeah. Yeah. So we use it a lot. We'll give it to, most people as long as they're not on narcotics. Um, we gotta watch out. Someone's on long-term narcotics, which we're seeing less and less of that. They aren't happy with you if you do it. But generally, once you do it, then you can give narcotics and it works okay. But it's kind of a weak version of the peptides.
Gotcha. Absolutely. What is something that you know today you wish you would have known 10 years ago?
Oh man, there is so much, and it's interesting when we talked about like doctors not reading medical journals, and it's I don't know, I get addicted and get excited. I'm must be geek central. I'll start reading studies, and all of a sudden it's, oh shoot, the sun's coming up. Oh, you got a patient in 2 hours. I'm like, but I mean, there's just so much to learn. I get my frustration is that, oh, nope, you can't do that because the FDA, it's too safe and effective, you know?
Right.
But yeah, I think immune modulation has changed my life. It has made practicing, all these, because people are at these multi-system illness patients, like, what do I do? And it's so simple. Start with this, and modulate the immune system. They're like, well, they got better. Yeah. And so it changes people's practice. And when everything got banned, people are just, oh my God, and then but the bioregulators have not totally replaced by any means, but added a whole new aspect. And because there's bioregulators for essentially every tissue, and there'll be a study published, a 3-year study, and they gave people, bioregulators for 3 years, and they lost on average with based on telomeres 5.5 years of biologic age, and then with the methylation, I think it was like 4 years. So that will be published. But we're just having great effects, like and the whole history of this is that, so the Soviet Union, in the 30s, 40s, they realized that their submariners, their high-speed jet pilots, and their cosmonauts were aging very quickly. And so they went to uh, Cavison, who was head of the Soviet, medical systems, and you shall fix this. I don't know. I can never do a Rush. I end up being German or something all the time. But and I don't know if he got lucky or some divine intervention. So he probably did a number of things, but he ended up getting fetal cow thymus and pineal gland. Combine those two, dramatic reduction in the accelerated aging. And those were extracts. Now, they kept it secret for decades, and they only gave it to the military and the Olympic team, which they did pretty damn well during that time, right? And
Hmm.
then with the fall of the Soviet Union, they started publishing, but it was in Russian. And so no one really knew. Then all of a sudden someone started translating these, and they're like, damn. Um, uh, and so so they end up having, there's 21 different bioregulators, everything from, brain, pineal, muscle, thyroid. Like on the thyroid bioregulator, it showed that, if your thyroid's too high, it brings it down. If it's too low, it brings it up. Antibodies, basic dramatic reduction in autoantibodies. And they're all just amazing. Liver, heart. The big one, I think, is vessel, and which is shown to reverse cardiovascular disease, improve cognition, and reverse Alzheimer's, and reverse cardiovascular disease. And the heart, all of a sudden, the heart starts pumping, the arrhythmias go away, congestive heart failure, all those things. And then when you look at, when you add, like we have a thymosin alpha 1, which was made to replace thymogen alpha 1 to replace thymosin alpha 1, but it boosts Th1, and they're actually two bioregulators. One's 3 amino acid, one's 2. And you can't believe the dramatic reduction in these studies in cancer, quality of life, and just fixing it. So you can now do that orally. And people, some people love injections, some people hate them, but or like BPC is shown to be equal. Every study that's looked at oral, that same study, oral versus injectable, they're equal potent. Unless you're injecting into a joint, you're going to get a difference there. But I should mention too, it's like, okay, what's this stable BPC? So the owner of the patent of acetylated BPC, the patent ran out. So he came up with stable BPC, which is an arginine salt. And then he said, did the study, acetylated BPC is not stable in the gut where arginine is. Well, there's a ton of third-party literature that says you can leave it in the gut for days and there's no difference. But let's just say that is the case. We'll use an enteric-coated capsule and you're good. And so arginine's, let's say, stable in the gut, but as soon as it gets into the small intestine and the pH change, that arginine splits off. So now it's just a salt that's dissociated, very prone to an enzymatic degradation. And so a lot of people add snack to it, which is a substance that breaks open the tight junction. So it's kind of like, well, you're using it to get rid of leaky gut and you're breaking open the tight junctions, you know. Now the body will acetylate, so it puts a cap on one end, and amidate peptides and proteins that are critical it wants to protect from enzymatic degradation. So those become very resistant to enzymatic degradation, and they become more lipophilic and gets through the into the gut, also into the cells, across the blood-brain barrier. And we will be actually coming out with like 20 new products, combinations, and liposomal and true liposomal. You know, most liposomes, they take lecithin, Buster goes shake it up and go, oh, it's a liposome, you know. But so we're excited with this next quarter that we've been really laying the groundwork. It takes us longer to I think come out with a product because we test the crap out of everything and make sure everything's right. Where other people just, okay, let's put it together. Here you go, you know.
Right.
But really excited. And that's kind of my passion, is doing research and finding new stuff. And although I love treating patients, but I tend to give everything free and spend 3-4 hours with them. So my accountants are like, don't see patients.
Yeah. Gotcha. Well, thank you so much for taking the time out of your incredibly, remarkably busy schedule. Hopefully we can have you back on in the future. So I'll text you tomorrow about that, and that way it'll happen a year and a half from now.
There you go. And what we can do, the peptide protocol for the rapid treatment of SEERS, we can put it on your site, and
Okay.
people can download that if that sounds good.
Yeah,
And a coupon code for integrated peptides. We can get that on your site, and you got a lot of great podcasts and information. So
absolutely. Well, thank you so much for the work that you're doing, and keep fighting the good fight.
thank you. You too. So really appreciate it. Thank you.
Absolutely. Thank you.
Great.